want to have a little bit of movement because completely still makes you look essentially a little bit less good at communicating with people, and you're more likely to get drops. So in this video, I'm going to be discussing Baby Botox or Preventative Botox, which is a hot topic on TikTok. There are over 4.3 million videos on this topic. So we need to understand exactly what our patients mean when they ask for it. And if you're a patient, you need to know exactly what your practitioner means when they recommend it. So this may not be something that patients want to hear, but essentially, I think Baby Botox is basically a marketing term.
It's not true. That's impossible.
It is a story that we tell that enables patients to feel a little bit more comfortable with having Botox at a younger age. I think at the bottom of this is how people feel when they ask for a Baby Botox treatment, which is that it sounds like something that's a little bit less threatening, a little bit less invasive, a little bit less extreme, a slightly gentle result. And all of these things are much more compatible with people who still feel young. If you ask a 28-year-old who's having Botox, she probably feels more comfortable telling her friends that it's Baby Botox. But we need to understand what exactly the difference is, and are those patients actually getting a different result? Because the video that I just saw was pretty much the same result as you might be aiming for, but it's probably a bit easier because the patient's younger. Now, one of the reasons that this treatment has come to light is that it is sold as a way of preventing wrinkles. So preventative Botox is, I think, a little bit of a risky idea for a couple of reasons. The first is, at what age is it appropriate to start preventing something that isn't there already? Because if you follow the logic, you could take it all the way down to everyone starting on their 18th birthday should start stopping their muscles from moving so that they don't get older. Now, the truth is you'll lose a bit of muscle volume, and you can actually look older when you have Botox younger because of the lost volume. Now, this comes back very quickly, so it's not a problem, but let's not argue that every patient who's 18 is better off having Botox. There's another very important reason for this, which is we all know from experience that if you wait until you get fine lines and wrinkles, so you might be, a typical age is probably around 30, 33, 34, and you have treatment then, you can completely erase those lines in 2 weeks. The lines do not last forever. So does it make a lot of sense to be preventing something over the course of 12, 14 years that you can reverse in 2 weeks anyway? For me, that's slightly unethical story because you're implying that without this treatment, patients are going to get stuck in a situation where they look older than they need to, which just isn't the case. You can reverse most signs of aging with a treatment aged 28. You don't have to have Botox for 10 years. And as I would quite often say to patients, like, put it towards buying a house rather than have a treatment for 10 years that doesn't actually prevent anything that can't be reversed within 2 weeks of your first treatment. There is another element to this as well, which is I think patients are beginning to perceive normal movement as a problem. Now, this can happen in younger people who don't have lines and wrinkles at rest, but as they start to move or express particularly negative expressions, so that's worry, concern, anger, all of those negative expressions, essentially they don't want them even though they are feeling them at the moment they express them. So it becomes this desire to just stop all negative expression. And this is quite an interesting issue for a good clinician to approach, because you effectively have to get your patients signed up to the idea that your face is not just about looking beautiful, it's actually a communication device. And it's quite hard to sell people this idea because most people value beauty more than they value expressing their discontent about something their boss said at work. But those things are valuable, and it's very hard to put a value on them, but it's worth having the discussion with your patients. So particularly examples that I like to use are people who have to lay boundaries down in their day-to-day jobs, which actually is everyone, but there are certain professions who are different. So if you're a teacher, particularly teaching younger children, they're very nonverbal, and your ability to create a negative expression to communicate with a child who's not listening or disobeying you can become a very useful tool for that child to know what the boundaries are. Similar if you're a policeman or a lawyer or even a normal doctor has to lay boundaries with patients. And it is useful to have a slight negative expression that conveys to people what you're thinking. If you completely remove the ability to do that, you're going to have to think of other ways to convey that information. And this is a potential disadvantage to you. It's particularly, to me, feels like a disadvantage when there are no lines and wrinkles there anyway. You've just subtracted the normal movement. It becomes different as those expressions are becoming set in. So this is really the heart of where Botox is valuable, is when you have an older person who's got a permanent frown line when they're not cross, then it makes sense to remove it because they're miscommunicating. But we don't want to subtract normal communication from people, at least not doing it without them being fully aware of what the downsides are. So Layla, my producer, has found an article from a patient describing the benefits of Baby Botox to her. Now, she gives a really good account of what she was really treating as a miscommunication, which is that she was frowning when she wasn't cross and giving people the impression that she was stressed, getting comments from people saying, "Are you okay? Or are you stressed?" when actually she was feeling normal. And this was a barrier to communication. This is actually the heart of what medical aesthetics is about, is enabling people to connect with others in a way that's more consistent with how they actually want to connect with them. I think that's a good indication for a treatment. And what she's describing is actually, I think, is basically a normal Botox result. Now, you can call it Baby Botox because it makes people feel like they're doing something less invasive. But the truth is they've stopped her frown line moving, her corrugator muscles from moving. So she's no longer frowning, which means she looks more relaxed, which means she can connect more seamlessly with people. And that is a really neat way to treat people and allow them to get on better in situations such as at work. But is it any different to normal Botox? I think it's a communication innovation. We've described it differently, but it's doing the same thing as other treatments do. So let's talk a little bit about dose, because the muscles we know are effectively about the same strength when you're young or old. They might be slightly weaker as you get older, but there's less fat resisting that movement, so they might move a bit more. But essentially, if you're going to stop a muscle moving, then you need approximately the same amount of dose of botulinum toxin. So if you halve the dose and then describe that to the patient as tiny, they might feel better about what they're having, but it's not a world apart, like a 12-unit dose versus a 20-unit dose. You might call that Baby Botox. It's a slightly lower dose. You don't need as much because they've got fat dampening the same movement. The end result is that they don't frown. And for me, that's the same outcome. It's easier to achieve in a younger person because they have other things that make them look younger already. So how do you deal with a patient who wants Baby Botox? The first thing is to realize that regardless of what you think is the result, they are asking for something subtle. So it's really important when a patient mentions a term such as Baby Botox to remember that what they are really expressing is a desire not to have anything too invasive, to look natural afterwards, and to preferably not look done in any way at all. And this is much easier when patients are younger anyway, which tends to be the patients who ask for this, but not always. But you must convey to them the complexities of this term Baby Botox and what it really means. If you do, for example, a light sprinkling of Botox, which sounds nice, on someone who's expecting an amazing result, who's got relatively deep lines and they still want movement, you will have to explain to them that they will have movement, and if there's movement, the lines will remain. If you get rid of the movement, then you might improve some of the lines, but then you're going to use a slightly higher dose. So the complexity comes with getting them to agree that a lesser result is what they want. You are still going to have lines and wrinkles. If they agree with that, it's very straightforward because you've essentially got them to sign up to the idea that it may not make that much difference, and you can proceed with that with a low risk of them being disappointed. What I experience in reality with those patients is they often come back for a normal follow-up and then have an additional treatment to try and get the actual result which they want. It's very useful to think about patients with this idea that they're buying a story rather than a particular product, service, or even the result. Because what I realized a long time ago is if you had a magic wand in your cabinet, and I sometimes say this to patients, that you could wave every morning and it would get rid of all your lines and wrinkles on your forehead, would you wave it? And of course, most of them would. What they are really concerned about is the negative stuff that comes with having Botox, and the perception and the story of having something invasive or looking frozen or unnatural. So once you understand that, you need to build your treatment around avoiding those things that they fear, and then you've got the increased chance of them being happy even if they don't get completely flawless result. So I hope you found that useful, and I hope it helps you with your patients. If you want to watch more about botulinum toxins, I have one specifically on how to inject a smaller forehead, and also another video on how to treat younger patients. Don't forget to like and subscribe if you want to see more videos just like this.